Lauren Boebert underwent emergency surgery for May-Thurner syndrome. A synopsis and literature review of this cause of deep vein thrombosis. Pause each illustration for detailed study of the illustrations and data contained in this review of the literature. May-Thurner syndrome, MTS, is manifest as the compression of the left iliofemoral vein by the right common iliac artery against the vertebral body after its origin from the abdominal aorta prior to the iliofemoral junction. The iliofemoral vein is the conduit for blood from the pelvis and legs back up to the heart. The chronic pressure from the overriding artery compresses the vein against usually the bony lower lumbar vertebrae, which can lead to venous spur formation. This compression prevents proper blood flow, resulting in vascular stenosis and scarring. The primary reported result is left iliofemoral vein thrombosis with corresponding right side involvement. The venous spurs and stenosis are secondary to May-Thurner syndrome. It has been postulated that chronic endothelial irritation results from the pulsation of the overlying artery and the resulting intraluminal spurs leading to clot formation. Fibrous bands are observed between the anterior and posterior walls of the iliofemoral artery. May-Thurner syndrome can be one cause of deep vein thrombosis, DVT. Most patients have been observed to be clinically asymptomatic since the obstruction is not substantial or venous collateral circulation develops, maintaining adequate blood flow continuity without the development of deep vein thrombosis. Lower extremity deep vein thrombosis may be precipitated in the presence of transient risk factors such as pregnancy, postpartum status, or surgery. May-Thurner syndrome often manifests during the second and third decades of life, more commonly in women. This syndrome is currently diagnosed by means of Doppler ultrasound imaging, computed tomography imaging, magnetic resonance venography, and venography with intravascular ultrasound, which is the preferred MTS diagnostic method. Current treatment and management of May-Thurner syndrome may consist of catheter-directed thrombolysis with subsequent endovascular stent placement, open surgical thrombectomy in cases with an occluded left iliac vein in the presence of an unsuccessful endovascular procedure. Vascular bypass and aortic elevation may be performed, as well as anticoagulant therapy. Congresswoman Boebert's treatment reportedly involved clot removal and stent placement to restore vascular patency, adequate blood circulation, as well as eliminate symptoms. The current mainstay therapy is such iliofemoral clot lysis with thrombolysis and thrombectomy, common iliac vein stent placement, and around 6 months of anticoagulant medication therapy. The iliac veins in the pelvis include the external iliac vein, the internal iliac vein, and the common iliac vein. The common femoral vein is below the external iliac vein. It is labeled simply femoral here. A CT scan showing thrombus in left common iliac vein. The magnetic resonance imaging angiogram depicting thrombosis and compression of left common iliac vein by the right common iliac artery. Pelvic venographic images in prone position demonstrating deep venous thrombosis, DVT, along the left common femoral, blue arrows, superficial femoral, white arrows, and popliteal veins, green arrow, with complete patency, red arrows, of left iliofemoral popliteal venous axis after thrombolysis, thrombectomy, angiojet radiopeg markers, purple arrow, and deployment of venous stent, venovo, black arrows, along the previously compressed left common iliac vein, yellow arrow, with stent extending towards the left external iliac vein in this patient with May-Thurner syndrome. Photographs of patients' lower extremities in prone position before A and after thrombolysis, thrombectomy, and stenting of left iliac vein B. Note the swelling and skin discolorations over the left calf, reddish alternating with bluish colored areas, blue arrows, due to obstructed venous return and resulting decrease in arterial inflow, representing impeding development of legmasia ceruleus dolens when compared to the right leg, green arrows. Complete resolution of the above physical examination findings, red arrows. After left iliac venous endovascular revascularization procedures via left popliteal venous access, black arrows. The coagulation system, often described as a cascade, includes a group of proteins that regulate clotting. DVT risk can be altered by abnormalities in the cascade. The regulators, antithrombin and activated protein C, are shown in green above the clotting factors they affect. New presentations coming soon. Like, share, subscribe, and ring the bell for notifications. Thanks for watching. Thank you to current and new subscribers.